1955. Eisenhower is president. A computer takes up an entire building. The idea of space travel is science fiction. And a hospital in Preston County starts construction. But times change. There have been 10 presidents since Ike. Almost everyone has a computer on their desk. Man is now living in space, and there are dramatic changes in healthcare. Yet Preston Memorial Hospital uses the same basic building built in 1955 and last significantly updated more than 25 years ago.
Building limitations create operational inefficiencies that are costing us upwards of $300,000 a year. This money that we're unnecessarily spending on things like utilities, higher maintenance costs, and structural changes is money that we can't spend on things like patient care and technology for our patients. Renovations don't make sense. We're going to spend $10 million on heating, electrical systems, plumbing systems, sprinkler systems, just to get those up to where they need to be. And that's before we even spend a dime on things like patient care and medical services for our patients. The second issue we have is our facility itself. The current floor-to-ceiling heights are too small to house a lot of the current technology of today, and while we can afford the technology, we just need larger rooms and better infrastructure to house that technology.
After careful consideration, plans are underway for construction of a new Preston Memorial Hospital. To be built on the old Alicia Thomas farm, about a mile from the current hospital, construction could begin as early as late summer 2013 and be completed in 2015. It's not about building a bigger hospital. In fact, changes in healthcare and a movement to outpatient services means the new hospital will actually be 15% smaller than the old hospital. The new Preston Memorial Hospital will be a right-size hospital with 25 all-private rooms. Besides providing comfort for patients and family, private rooms reduce the risk of infection. The emergency department will be 60% larger, with rooms dedicated for cardiac, trauma, and psychiatric patient evaluations. The new hospital will expand outpatient services, keeping local patients from having to drive to other towns 1, 2, or 3 times a week for outpatient services. A new hospital will allow Preston Memorial Hospital to continue to be the leader by bringing the latest medical technology to Preston County and the surrounding area. Included in the new hospital plans is a medical office building. These offices will create a campus concept and assist in recruiting physicians, especially hard-to-recruit medical specialists. With the government and insurers paying about 38 cents on the dollar of billed charges, a new, efficient hospital will help preserve Preston Memorial Hospital for decades to come. The new hospital will cost $35 million. Preston Memorial Hospital can afford to pay $25 million of this cost through the use of cash reserves. A certificate of need has been approved. The remaining $10 million will be paid for through a combination of public and private financing, including the Building for a Healthy Future capital campaign.
There's a long history of philanthropic support for Preston Memorial Hospital. This campaign is important. With all the changes to healthcare nationally, one thing remains constant. Local care in local hospitals will be the front line in community care.
The current building will be evaluated for many different purposes, and when the time comes, it will either be sold or used for other community benefit. In the end, the decision isn't a choice of whether or not to keep working in the current hospital or to build a new one. Working in the current hospital is just not an option. In the last 20 years, over 300 hospitals throughout the United States have closed, mostly because their buildings couldn't keep current with changes in technology. Preston Memorial has a local economic impact of over $47 million and is a key to economic development. A $17 million payroll and over 300 secure quality jobs is important, but perhaps equally important is the role healthcare plays in attracting new companies and employers. Since hospitals have to compete for a limited number of physicians, recruiting good physicians to this area, especially medical specialists, requires a state-of-the-art hospital and medical office space. More physicians and more services mean more and healthier patients, which equals a more secure future for the hospital. The increased revenue means having the funds needed to invest in new technology and new services, the lifeblood of any hospital. In the end, however, having a hospital that will meet and exceed the needs of the local community is the most important reason of all to build a new hospital.